Philanthropists Bill and Melinda Gates have just released their annual letter highlighting gains made in global development, including a mother's well-being, education, and childhood health. Efforts of organizations such as the Bill and Melinda Gates Foundation have helped save the lives of 122 million children since 1990. I spoke by phone with Melinda Gates in a VOA exclusive interview and asked her what is her reaction to the progress made in global development.
Well, the progress is really astounding, and it's the progress that the world has made. And so it makes me even more optimistic about what we can do in the future, because not only has this progress been made about lives saved, about people lifted out of poverty, but it's accelerating now, particularly in the last 5 years. So there is so much more that can be done.
One of the examples is the number of childhood deaths per year has been cut in half, according to the United Nations, since 1990, and 122 million have been saved. These numbers are really, really encouraging.
They are absolutely encouraging, and the great thing now is we have even more data. We know what has saved those children's lives. It's been predominantly malarial bed nets and vaccines, but we're seeing the number of children's deaths go down, and we're also seeing that, okay, the deaths that are still left are particularly these newborn lives, these first 30 days. 1 million kids die on the first day of life. And so we also know now, okay, this is where we also need to act.
So how do we act?
We get more data. And so one of the things that we point out in the annual letter is that parents in Africa are letting us actually do now very thoughtfully these minimally invasive autopsies, and it allows them to understand what did their child actually die from, and then they let us use that information, that data, so that we can understand what lots of kids die from, and then put great tools behind that. And that's actually really exciting.
The Bill and Melinda Gates Foundation has played an important role in global development and improving health. What did it take to achieve this gain in children's health in particular?
First of all, the foundation does all the work that we do is with partners all over the world. There's nothing we do without a partner being involved. And the other great thing is that the United Nations set before these Millennium Development Goals. They're now the Sustainable Development Goals. But it gave a roadmap, a blueprint to the world of how should we tackle death and disability around the world. And so one of the things that the foundation focused on with our many partners was on these childhood deaths. And a lot of new vaccines came out, particularly around pneumonia deaths and diarrheal deaths. Those are the two biggest killers of children still around the world. We needed new vaccines that didn't exist for those. Those vaccines now not only exist, but they're being delivered all over the world in some of the most remote rural places in Kenya and India and Tanzania. Parents are accepting them. The vaccination rate is up to 86% now around the world. We need to get that, honestly, to 100%, but parents are seeing the benefit of that. And parents are also choosing to get a malarial bed net because governments are now giving them out all over Africa, and they're not only getting them, they're actually sleeping under them because they see the benefits for themselves and their children of fewer malarial episodes in their households.
And you mentioned vaccine. Would you elaborate on how investing in childhood immunization is not just good for the child's health, but also beneficial to the economy, because that's something that a lot of people are really struggling with to understand?
If a child grows up healthy, and then they have their greatest potential of being educated and going on to get a job and producing economic means for their own family. And ultimately, if they lift up their family, they're lifting up their community and they're lifting up a whole economy. So we call that the demographic dividend. That is, if you get a healthy population of kids that get educated and then get into their productive working years, late in their teenage years, literally you see gains in your economy overall. But they have to start healthy in life, which is why vaccines are so important, why getting fewer malarial episodes is important, why getting the right nutrition is important so that they can grow and reach the potential they have, both cognitively and developmentally.
So moving forward, what are some of the key issues that will be on top of the agenda for the foundation, especially with childhood health?
Well, you're going to see us continue to make investments and maybe more investments in nutrition because, as I mentioned, that first 1,000-day window is so important that if a child doesn't grow up healthy, they don't have the chance to reach their full cognitive. Where they grow up and what their immune system is facing in those first few years of life is very different in a country like Uganda versus Kenya versus South Africa. So we don't even understand as a world enough about a child's gut to understand exactly what intervention we should make. Should we give them more zinc? Should we give them more vitamin A, more vitamin D? So until that research agenda gets completed and filling it out will help us understand how to make the most key investments. You'll see us continuing on vaccines and really looking at this first 30 days of life of what else we can do to save so many children that die in those first 30 days.